This is being sponsored by Chosen, which is our interdisciplinary center, which is across the university and primarily led by the School of Social Work and Columbia University's Department of Psychiatry and New York State Psychiatric Institute, and also in conjunction with SIG, obviously. So I'm delighted to be here and listen today. And Tim, and as well as his colleagues, I think have developed a very exciting program for this afternoon. Thank you, Tim.
Thank you so much, Francis. So again, we are very excited to bring you this program today and to have a discussion together about the ways to improve community engagement with the criminal legal system to address opioid overdose. We want to immediately acknowledge, first of all, people who are living and are impacted by overdose, both those families and have experienced it themselves or experienced substance use disorders or have been incarcerated or currently incarcerated. We also want to thank so much and acknowledge the support from the National Institutes of Health and the National Institute of Drug Abuse and the Healing Community Study, which some of the outcomes and research and model you'll be hearing a bit about today, which engaged 16 New York State coalitions as part of the intervention. And we welcome you to look at some of the publications we'll be sharing at the end of the webinar on many, many outcomes that are coming from this work. So thank you to the investigators of this particular study, to NIDA for the support, and the principal investigator, Dr. El Basel, as well, from the School of Social Work. We will be sending out an evaluation at the end of this event, and we welcome your feedback about the value of this particular conversation. So this is co-sponsored. We'll talk a little bit about the sponsors, as you just heard from Dr. Levin and the Chosen Center. We'll be going over a bit the goals of the webinar itself. I'm going to give a bit of a high-level overview of overdose in the U.S. and in New York State specifically, and its relationship to the criminal legal system. We'll hear a presentation from the commissioner, associate commissioner from OASAS. I'll introduce them, as well as the Oracle team from Ulster County, New York, which is an integrated model between community, between law enforcement, between people with lived experience together, working together to engage people who are at risk. And then we have an amazing panel for you. We'll be talking from multiple levels of the criminal legal system, including lived experience. So you'll be hearing from not only a judge, by the way, should his trial that he's right in the middle of allow him to leave that particular trial. We'll be hearing from a chief of police. We'll be hearing from others within the criminal legal system, and I'll be introducing each one of those at a separate time. So our goal today, again, for the Chosen Center, you just heard about this integrated center and collaboration with mental health, with social work, with the translation center. We also, on the next slide, the social intervention group, which is a research arm of the School of Social Work. On the next slide, you'll see some of the leadership there, and very much welcome your partnerships with us as we conduct research across many different issues, including substance use, HIV, implementation science, and we also train new researchers as well, with a real commitment to equity and making sure there's inclusion of diversity. The Healing Community Study, some of you may be familiar with, so I'm just going to say one slide to give you a quick overview. We completed the intervention actually in December of 2023, and are doing the final write-up. Our outcome papers are coming out. This particular study was the largest community-engaged study looking at overdose in the U.S. in 67 communities across 4 states, addressing a potential 8 million population. The goal was to reduce overdose through a community-engaged and data-driven approach, engaging community coalitions in each of those counties or towns if they were identified. And the goal was to promote evidence-based practices, which include overdose education with naloxone distribution. They include the increased access and retention in medication for opioid use disorder, or MAT as some also know it. but also looking at safer prescribing and the training that is needing around opioid prescribing or take-back programs of medication, all along the way through communication, reducing stigma, raising awareness of services, and increasing harm reduction approaches. So we welcome you to see the websites that we'll be giving you. If you want to see some of the papers that are coming out around the many findings, we want to thank all the communities and those people with lived experience that have joined us. Today's purpose for the webinar, we want to have a lively discussion around both successes and challenges in engaging community strategies to address overdose with the criminal legal system itself. We want to provide examples of that specifically, and you'll hear from the multi-level intercept model, which we partnered with the Gain Center to implement in many of our counties as we did action planning, identifying strategies to address all along the intercept from pre-arrest to arrest or even incarceration and post-incarceration. So we'll talk about the opportunities that are there, especially during a period very challenging during COVID, as well as a change in New York State that impacted the census in jails, bail reform as well. So we've asked our panelists to be really honest around some of the challenges and solutions that they have noticed. To begin with, we're going to ask you if you will take your cell phone, take this QR code if you would, and we're going to ask you what is one thing that you would like to learn from today's topic. So take a moment, enter your suggestion, your question, your interest, and let us know. So we're seeing how to fund strategies, areas for collaboration between systems, really want to hear from the communities about their work, how to reduce barriers to opioid use disorder and HIV services in the criminal justice space, legalization of substance use, is that and ensuring a safe supply, is that part of the strategy? Alternatives to criminal legal system to deal with these issues, absolutely. And how can we reduce numbers of overdoses in general? How to help people in the months between release from incarceration. Does linkage and transition planning, closing the gap between service gaps, reducing recidivism, reduce the risk following incarceration? Absolutely. We're going to talk a bit about that elevated risk. So I think actually most of these are going to be covered in today's presentation. So thank you so much for sharing that. So just quickly to lay some of the groundwork, we just came out of the May, which was a mental health awareness month. Many of you have seen these stats before. The estimated 20 million people living with a substance use disorder, something like one in 10, 43 million with a mental health issue, and an estimated 65% of people who are incarcerated having a substance use disorder. And then the amount of money we're spending, $80 billion a year on incarceration, and ways that we need to address this and reduce the need for this in our society, as well as ways to improve the services being delivered. So you can see here, this was meant to show just trends in overdose. On the left-hand side, you'll see in the US, you've seen this dramatic escalation of overdose over the last few years and very quickly during COVID. But the good news is you're seeing a downward trend starting to take place, and we're trying to understand what that is about. And what's interesting, you can see on the right-hand side, the New York trend very much follows very much the US trend as well. So this data is, some of this is provisional data that we're sharing here, and we're looking forward to see how this trend continues and the efforts that you all are making to reduce overdose across the intercepts is what we're looking at. So post-overdose, we know that we're going to hear in a video very directly from our community members in just a moment, the elevated risk of overdose within the first 2 weeks following an incarceration period. So some 12 times risk, again, meaning a lot is that around forced detox, not maybe having access to medications that are needed. Again, the change in supply when someone is released, when they're actually using a particular supply amount or type, consistency, and then they're changing that when they leave. So again, the access again to methadone and counseling within particular jails and prisons are needed to continue. New York is leading the way with our new legislation. We'll talk about it in a moment. But we need to continue to improve the access to medications needed, the screening and assessment that is needed, because the untreated part of this increases recidivism, overdose deaths, but also other co-occurring issues like HIV, hepatitis C, and B infections that we all need to be addressing while they are in contact of the criminal legal system. So again, New York is leading the way in many ways. Our governor signed legislation in 2021 that went into implementation October of 2022, and we're going to hear directly from some of our community members, people with lived experience, about how it has impacted their work in the field.
I was a heroin addict for a long time, and every time I went to jail, I had to detox, and it doesn't get better. I know that other jails have it, and I think it should be available to us.
So I feel like my experience would have been different if I would have had access to MOUD in jail and prison. It's really hard to focus on what's going on with your case, your criminal case, when your disease has you focused on, just trying to feel better from withdrawal symptoms. And I was incarcerated on both occasions. There was no medication. It was basically a cold turkey, as they call it, detox. It was very painful, very uncomfortable. The mental part of it too. It's really hard to focus on what's going on with your case, your criminal case, when your disease has you focused on, just trying to feel better from withdrawal symptoms.
In Columbia County, we have had a Vivitrol program in the jail for some time. However, the broad access to all medications for OUD and the more comprehensive approach to access that is envisioned by this legislation will be sea change for our community. We have a number of really impactful programs and efforts working to combat the opioid epidemic and a fairly comprehensive network of services. But I really think that the addition of MOUD access in our jail to this network of services is very likely to have the most significant impact on the opioid overdose fatality rates that we've seen in some time.
By, actually treating the disease, which is addiction, we have a far better chance of helping people who are constantly, in and out of jail, homeless, committing crimes, to better themselves and better their lives. And that in turn helps the community overall.
The research is also clear that people of color, people with behavioral health diagnoses, people with developmental and intellectual disabilities are all overrepresented in the criminal justice system, including in our jails. For a number of reasons, including structural bias in the criminal justice system, inequitable access to resources, the bottom line is that vulnerable and underserved people are disproportionately incarcerated.
So we will share that video also if you want to take theirs a bit more. But again, we've talked about the sequential intercept mapping. Again, we've worked with the Policy Research Associates, Inc. and the SAMHSA-funded Gain Center, who developed this particular model, which illustrates the opportunities along the continuum of touch points between pre-arrest or even crisis, walking into an example for a police station and asking for help, or being pulled over while driving under the influence, moments in which we can intercede, pre-arrest, rest along the way, or diversion programs, alternative to incarceration programs. We have treatment courts that you hear a bit more about, opioid courts, the first in the nation in Buffalo, that has shown to improve outcomes and linkage to care, as well as, again, reentry programs, discharge planning that's instituted, linking people to care with supports, peer navigation, and case management. And in the community, those parole and probation programs where the goal is to link people to not only treatment, but also other services such as training, education, employment, housing, and other things that are needed to keep people moving along, improving the quality of life for them, and ultimately will reduce recidivism and improve the quality of life of people who have come in contact with the criminal legal system. The Healing Community Study, we tested an intervention called the Communities That Heal, as I spoke about earlier, building on community engagement and a data-driven approach. A part of the menu of options of evidence-based practices we will show you the link for on our websites, RTI's website, as well as SAMHSA. You'll see an ORCA menu, for example, of evidence-based practices that include, as I mentioned earlier, overdose education, medications like buprenorphine, naltrexone, methadone, available that we know improve outcomes for opioid use disorder and reduce overdose, and then safer prescribing. There were 3 requirements around sector. You must work with the 3 sectors: health, behavioral health, and criminal justice or criminal legal system. Today, we're focusing on the criminal legal system specifically. You can see across the 4 states, the strategies, the number of strategies that were selected in the criminal legal system, and their attachment to each of the 3 evidence-based practices. We know that combining overdose education along with medications is the most effective strategy. You can see also in coalitions in New York State, in our second wave of counties, the numbers of people that represented these particular sectors in the criminal legal system: courts, government engagement, also incarceration, alternative to incarceration programs, as well as police departments. It was amazing to see coalitions sitting there with the chief of police, the sheriff, probation officers, and also people who are living through that experience as well, providing input along the way. We were able to actually, through the Healing Community Study, fund technical assistance to set up the treatment court, opioid court in Greene County specifically. Again, seeing what is cultural shifts in this particular sector. Again, moving away from a moral failing to this is a medical condition that needs treatment. You can see that an average national completion rate in drug courts is over 60% compared to a 23% voluntary treatment process. So there, you're talking about savings here, returning up to $27 for every 1 investment in those courts. And again, there's a lot more data that will be coming out of research with the Gain Center around this particular area to see how we're reducing overdose deaths as well. And we're hoping you'll hear more from our judge later in the panel. The first step as part of the technical assistance was to engage the community across the intercepts to see what they are doing currently when it comes to each of these touch points and where are their gaps or opportunities. So this mapping took place over the course of a really expedited 1.5 months, and from that became an action plan, and it informs the treatment rollout of that particular court. We were very excited in one of our counties, Sullivan County, unfortunately having the highest rates of overdose deaths in New York State, had applied for the HIDTA status, which is the high intensity drug trafficking area. They had applied 3 times. Our HEAL program manager, working with our state senator, looked at the data more comprehensively, reapplied. They were reallocated as a HIDA data area, which meant they were going to have resources. That means there would be more law enforcement working with the community there, and where data analysts would actually be there ready to work with strategic planning. So finally, again, with all of this work, when it comes to linking communities, the different touch points someone may come in into play with, we know the historical work of the experience of trauma and the conflict sometimes with law enforcement that sometimes can get in the way of community engagement. We know this is effective, but we still have not seen enough of that kind of engagement, and we need to know what is effective or not. So that's why we're going to turn to our presenters today to give us examples of that effectiveness from our state partner. On the next slide, we're going to hear directly from one particular example. We're going to hear from our Associate Commissioner, Rabiah Gaynor. We're so glad that you've been our partner all along in the Healing Community Study. We welcome your input and insights from the State Office of Addiction Services and Support. And if you want to say a little bit about yourself as you get started in your presentation. Second, I will move right into the opioid response as county law enforcement or Oracle team approach in Ulster County. You're going to hear from Julianah, Abimbola, as well as Lieutenant Chad Storey. Their experience, which has been nationally recognized program, an integrated program that has been quite successful in linking people to care post-overdose and post-incarceration as well. So I'll turn this over to the Associate Commissioner.
Thank you, Tim. Good evening, everyone. My name is Rabiah Gaynor. I am the Associate Commissioner of Criminal Justice for New York State Office of Addiction Services and Supports, also known as OASAS. Next slide, please. I cover New York State, just, to let everyone know, including New York City, and I travel New York State, and it's very, very interesting. The New York State Office of Addiction Services and Support, we have our mission, and our mission is to provide support and oversee a data-driven continuum of addiction services delivered with equity, dignity, compassion, and respect. We are very big on our mission, and we try to use our mission to support everything we do. Our OASAS continuum of services includes prevention, treatment, harm reduction, and recovery. So although I'm the Criminal Justice Division, my agency, my colleagues, the executive team, we cover everything for New York State in regards to addiction services. Next slide, please. I just want to give you a brief overview of the OASAS system. We oversee more than 1,700 prevention, treatment, harm reduction, and recovery programs. We serve more than 730,000 individuals per year, and I believe those numbers have increased. And we operate 12 addiction treatment centers, also known as ATCs, throughout New York State. You can go to the website and find out all the locations of the ATCs. Next slide, please. This slide I'll go through briefly. This is my team. I have a new director starting July 1st, and this is my team, including myself. You can go to the next slide. We're expanding medication treatment for substance use disorder in prison and jails. I gave a little map just to kind of pinpoint to give you an overview. The state law the state law was written and signed in 2021. It went into effect October 7th of 2022. It requires that medication for treatment for all substance use disorders happens in carceral settings. This includes the county jails throughout New York State and New York City, as well as the New York State prisons. This is the largest implementation of MOUD in the state carceral system in the United States. New York State is leading the way. Next. Medication for opioid use disorder. There are 3 FDA-approved medications: methadone, buprenorphine, and naltrexone. And they come in different forms, but those are the list of medications. We also have medications for alcohol use. We tend to forget alcohol use disorder exists, but that exists as well. And that is Campral, Wellbutrin, and Antabuse. And naltrexone can also be used for alcohol use disorder. Next, please. OASAS and the OTP partnerships. I can't give a presentation without acknowledging our overdose treatment programs, also known as OTPs. We have a Bureau of Opioid Treatment and the Division of Criminal Justice, which is my division. We worked very hard in 2023, identifying jails that we had to give waivers to, methadone waivers, and the reasons were distance, lack of access to OTPs. So we worked hard in linking the county jails with OTPs within a reasonable distance. We identified OTPs within county and neighboring counties. We held introductory meetings to develop the relationships with the jails and the OTPs. We provided technical and regulatory support and do ongoing. We obtained written and verbal agreement confirmations so that the jails had something to work with. And that is an ongoing goal of OASAS, to keep the OTPs in jail connected and to make sure they have healthy relationships. Next, please. The goals for services in New York State prisons and jails: addiction treatment, access support services at every New York State jail and prison. That's very important to know. This law is in effect. Why is OASAS here? We're here to offer support, guidance, written guidance, verbal guidance, ongoing technical assistance, and to help people bridge the relationships that are needed. This treatment needs to happen during incarceration. We also need to make sure that people have reentry services and they have a good transition to the community. Priority services are medications for addiction treatment. People also say medication for assisted treatment, but the current version is medication for addiction treatment. We want to ensure that people have peer support behind the walls and outside in the community, individual and group counseling, and reentry and discharge planning support. Next. Initial outreach. So what has my division been doing, right? That's really what I want to talk about. We know the law went into effect. We know everybody said that everything's going well, but we needed to find out, because we needed to know who needed support, who needed additional funding, and so on. We obtained crucial information about how the medication for addiction treatment programs were running in New York State. We completed 2 waves of informational surveys with each facility regarding discharge planning, outpatient connection with opioid treatment programs, employment of peers, having peer support in the carceral settings, making sure that all forms of medication were available. And we wanted to know how OASAS can assist. Next. Our findings, right? So this is what we learned, and we're still learning on a weekly basis, to be honest with you. Most of the jails are meeting the essential criteria. They're providing the 3 forms of medication. That is a fact. They're doing discharge planning and they're even doing post-release follow-up, which is amazing to see. They're making sure and following up to make sure, to the best of their ability, that people made it to their opioid treatment program appointments or to whatever appointments that were scheduled for them. We have peers working with the people who are incarcerated. And we want the peers to know that we don't want them to be overwhelmed, but we want them to make the connection with a person so a person feels safe and comfortable to get their support. What I've learned is, right, I want to be honest, all jails don't have peers in place. Partly is because they need to secure the funding. They need to see what hours they may need peers. They may not need someone full-time. There's a variety of reasons. So the OASAS criminal justice team is working strongly with the jails who are in the process of getting peers and who still need peers so that we can help them move that along. Next slide. There are continuing challenges and best practices, right? Tim said, we have to mention what is really happening. Stigma still exists, right? We want to reverse stigma, but that takes time. That takes daily interaction. That means changing the language. That means demonstrating with our financial funds, with our language, with our messaging, that we have to treat people as human beings. Harm reduction, prevention, misunderstanding. A lot of people can be for harm reduction or against it. So we try to educate people on harm reduction. There's a variety and a buffet of harm reduction tools that can be used. Some people have resistance with medication for addiction treatment, right? And so we want to educate people, enlighten people, and let people know it's not just about following the law, but we want to let them know the benefits to their carceral setting, to the persons in custody, to the community. And diversion. I can't tell you enough how diversion comes up in many conversations because it's real, right? Human nature, people sometimes don't always want to do the right thing. And we have to help usher them along to do the right thing. But we don't want to penalize them. We want to educate them, counsel them, give them another chance, right? Because they need the medication. And if they choose not to take the medication, then we want to respect that. But we don't want people to divert, hoard medication, try to sell it, try to extort people. We want to, stop that. Best practices. Best practices comes through a variety of ways. Correction officers carrying Narcan, being Narcan trained, also known as naloxone. Providing resources, discharge planning upon spontaneous release. Sometimes people go to court, they get released. So we want to make sure we start the discharge process in the county jails when they enter. And that can be a basic conversation with resource material. We want to make sure we touch base with them to let them know you may leave here in a couple of days. You may be here longer. But if you do leave, these are the places or the connects that you can go to. Okay, next. We have mobile medication units to expand statewide. So there's mobile medication units, and these are units where people can go and get their medication, get a checkup, and be seen. We have 2 online right now in New York City, and we're looking to have the rest go online very soon, sometime during this year throughout New York State. Next. Next steps for our team. Cross-division collaboration, that's very, very, very strong on my to-do list. I collaborate with the Harm Reduction Division, with the Addiction Treatment and Recovery Division. Their peer integration team assists with helping with the peers in carceral settings, as well as helping with get peers into the judicial system. We have a medical learning collaborative up and coming that many people will learn about soon. And that's designed to help the correctional health providers in the carceral settings get education, get enlightenment through our chief medical office here at OASAS. We examine staffing and funding concerns, right? Everybody tells me we need money. We can't keep talking without, putting the money where our conversation leads us to. So OASAS now, although we always give state funding, right? That is always happening. And we're giving addition funding. We're trying to find out how to give additional funding to help support medication, to help with the discharge plan, to help with the peer support. So we're exploring ways to increase the funding that's already being given. Thank you very much. And I will turn it back over to Tim.
Thank you so much, Rabiah. And really appreciate that insight, and we'll be welcoming your response to questions in just a few minutes. I'm going to turn it now over to Julianah, and I'll have you introduce both you and Chad, and we look forward to hearing about the Oracle's approach.
Good afternoon, everybody. My name is Julianah Abimbola Ogundimu, and I'm a team lead for the Oracle, which is the Opioid Response County Law Enforcement under the Ulster County Sheriff's Office. And I'm here today with the team head coordinator, who will introduce himself.
Hi, everybody. Chad Storey. I'm a lieutenant with the Ulster County Sheriff's Office. I've been in law enforcement starting my 28th year now. And Julianah is my new partner in crime.
Thank you very much, Chad.
So just a little bit about the Oracle team. So in 2019, Sheriff Figueroa was elected to the office of Sheriff for Ulster County, and he came in with a vision. His vision was to combat the opioid crisis going on in Ulster County. And he had a few ideas, and along came the Oracle team, Opioid Response as County Law Enforcement. So basically the makeup of our team is a crisis intervention team training, which is a 40-hour block of training. That's what our officers in the Oracle team, that's one of the bases that we use. So currently we have 2 full-time law enforcement members assigned to the team, along with 2 peer advocates, 2 case managers, and obviously Julianah, who is certainly the brains behind this operation. And we certainly couldn't be where we are today without her. So our team is ultimately, we receive referrals from a variety of sources, one being the 911 center. When a 911 call is placed, we get an alert almost immediately. that there's a potential overdose. Law enforcement agencies themselves actually send us referrals. So ultimately, we're getting probably almost 100% of the overdoses in Ulster County are coming to us through some form of communication, whether the 911 center or actual referrals from law enforcement agencies or the community. We also established a community hotline, which is answered 24 hours a day, most of the time by Julianah or another team member. So if you call that hotline, you're not going to get an answering service. You're going to get to actually speak with somebody live. And then onto our overdose prevention program. So this is key in so many factors of what we do, and it's the community outreach portion. We are in the county fairs. We're anywhere we're asked to go for a community event, we go, and we provide education and Narcan training, and basically just making that initial connection. And we've had so much success just being out there in the community and doing table events where people are just walking up to us, and either if they're referring a friend or actually asking for services themselves. And then we are just starting to get into one of our final stages of the program, and that's the jail reentry services. One of our team members, one of our care managers, is now currently full-time working as a jail reentry coordinator, and we're still learning that process a little bit. But one of the overall things that I want to say about the Oracle program, which kind of sets us apart from some of the other programs out there, is the follow-up that we do. So if we're working with an individual and we're able to get them into treatment, when they're getting released, we still maintain contact with that individual, and we'll follow up with them at 5 days, 10 days, 30 days, 90 days, or whatever is necessary to keep that individual successful in their recovery. Same thing with our jail reentry services. That's one of the things that Kevin, our care manager that is in charge of that now, is finding out, is the follow-up once the person is discharged from the facility. You can go on to the next slide. So I already kind of talked about this a little bit. The prevention part of it, the naloxone training, the hidden in plain sight. We were very fortunate to have a community member donate us a camper. And that was one of the first community events that we did. With the camper, we set it up with, hidden in plain sight. So looking for drug paraphernalia, and, you take an individual through and you're like, hey, this is some things signs and symptoms you can look for if you believe the loved one might be using. And then at the end of that, we would always provide Narcan training and give them Narcan. The referral system I talked about already. We have referrals from community members, from the 911 system, from our law enforcement partners. We've actually come to a point now where every law enforcement agency in Ulster County sends us overdose reports, so we can gather the data as well as follow up with the individuals as necessary. And the co-response team has been so successful. We in law enforcement have the ability to access a lot of data, which are some of our community partners don't have the access to. So the linkage and the information that we can gather and provide to some of our community partners, as well as the Julianah side of the house, is very helpful. So that collaborative effort between the civilian side and the law enforcement side has proven to be very helpful. And the linkage part, the peer support and the treatment I talked about as far as the follow-up. That was one of the things when we looked at a couple of the other programs out there when starting Oracle, as there was never really any follow-up. So that's one of the things that we really wanted to drive home with our team, is the follow-up after somebody comes out of treatment or after somebody is discharged from the jail, was the follow-up care. And then, so what does this model do for us? We've actually started an AVERT team, which is an anti-violence effort team. That's essentially we're targeting troubled youth, more so troubled youth that are involved in some type of weapons charge. And we're using the same model for that as well. We currently have access to a social worker as well as one of our detectives that's assigned full-time. And then we're right in the process now of starting our SAFE team, or our mental health response team. And we're in the process of hiring some people and getting that up and running as well. And that'll be similar to the Oracle program, but be able to get referrals for mental health, people in mental health crisis as well, and to be able to follow up. Next slide. Turn it over to Julianah.
Thank you, Chad. So what I've learned, the collaborative community response in that we need the community to help to run this program. We need the buy-in of the community members. And so you find in an overdose call, we have a referral through the 911 call, so, referred to the sheriff's office, and we have that co-response that happened. So what do? We do the treatment harm reduction linkage. We help individuals get into treatment in and out of New York State. We advocate for a treatment program to take individuals. We also have where we can get scholarship. And what do we have? Right now in the sheriff's office, we have $20,000 worth of harm reduction materials, which we give out. We give out in the community. We have weekly tabling. And just like Chad says, most of our community event. We have a weekly high-risk mitigation team, which the Oracle coordinates every week, where we look at overdose happening in Ulster County every week, and we make sure that each overdose has respond. This has really helps in bringing down fatal and non-fatal overdose in Ulster County. So there's a referral to team members, based on what the individual needs. So we have a huge team. The Oracle team is so very efficient in the way they respond to individuals that struggle with substance use. So we have community peer team members, and there's a whole lot of collaboration that goes on in the county Department of Mental Health, Access Support for Living, Department of Health as well, Catholic Charities, LNV Regional. Most agencies have collaboration with this program. Next slide, please. So what have we learned? We have learned a lot of things. We have learned that everyone is important. We have learned that substance use disorder is a disease. We have learned that everybody deserves to be treated as an human being. We have also learned that law enforcement can actually, there's a paradigm shift going on in law enforcement, just like Chad has said, where, you find civilians and law enforcement working together for the whole goal. Who do the person call when they have an overdose? They call the 911 line. So we need to work together collaboratively to help individuals in the community. What have we learned? This program is successful because there's community buy-in. If there's no community buy-in, we will not be helpful in this community. There's collaboration at all levels. We cannot take credit for the success of this program, except taking collaboration as all members that are here in all agencies in Ulster County has really helped. We can see a lot of advocacy and collaboration going on between the sheriff's office and all different agencies within the county. We can also see that Oracle is now in the Ulster County Jail, where we move individuals from the jail into treatment program. There's a lot of advocacy. We get referrals from probation, from parole, from the court. The judge is calling us. So we have learned that individuals that need help do not need to be in jail. What we need to do is to help individuals get the help they deserve. We have learned that NACAN helps, harm reduction helps. Last year, we gave over 4,000 NACAN in the community. This year, this month, we've already given about 3,000 NACAN in this community. People are helping themselves. We have the naloxone outbox program. We have the naloxone inbox in different companies around Ulster County. And we have also learned that even in the work we do, we have learned that mental health needs to be addressed. We have the SAFE team, which is already come up, just like Chad has said, where individuals are able to triage for mental health. We have learned that there's intentional overdose and there's unintentional overdose. So all those learnings have helped this program to become what it is today. Chad, anything to add?
I just want to add one last thing as far as the collaborative effort between the civilian side of Oracle and the law enforcement side of Oracle. One of the things that we've kind of been successful with is, we're able to, through our data, do some hotspotting throughout the county and actually send a team member, a peer advocate, and a law enforcement member out to those specific hotspots and just have them, set a table up with Narcan and some, other supplies and harm reduction supplies and just hand them out just to start engaging individuals with conversation. And that has seemed to help a lot with the community buy-in from those particular areas. And it has also helped us get some people into treatment that certainly need it.
just to add on to what Chad has said, data-driven decision, all our decisions are data-driven. We have a database which we use to navigate decisions that are very impactful in this community. And we cannot thank the Columbia community, the Healing Community Projects enough for the collaboration they've had in Ulster County. And that has been so impactful in bringing the numbers down. Thank you.
So here's just some of our stats from 2023. Like Julianah said, we provided 48, almost close to 5,000 Narcan trainings to individuals. We had 753 referrals, and the numbers speak for themselves. I'm not going to read them to you, but I think the biggest number on this slide is the 56% of program retention beyond 30 days. And that just goes with the follow-up from our peers and our case managers. Next slide. Some of our community partners. And certainly I could tell you that, you know, we're talking about all the great things. We've had certainly had some speed bumps along the way. We've had some lessons learned, and it took a lot to get our program sold to our other law enforcement partners in the county. But now they don't hesitate at all when they're going to an overdose call, or even are maybe potentially working with an individual in their community that needs help. They call Julianah, they call the hotline, or, you know, they just call one of our members directly now. It's really great. That's my contact information. I'm pretty open to emails all the time. I get dozens of emails. Actually, I just got one today from Onondaga County looking to get some information about our program. And Julianah and I usually leave ourselves open for communication, no matter when it is, if somebody needs help.
Thank you so much, Julianah and Chad. What a rich program. And Rabiah, really appreciate it. There are questions coming in the chat, and I think we're going to do a combination. We'll keep trying to respond to those questions in the chat if we can, and we want to make sure there's time for the panel today, and we'll continue to answer questions in the panel itself. Certainly, Rabiah, there's one really rich question around, do we have evidence around the impact of medications, for example, on reducing recidivism or linkage to care post-release, or reducing overdose? And there's a lot of literature, and I don't know if you want to respond maybe to that one question or not.
Yes. So that's a good question. So thank you, person who asked. There is medication and access to medication upon release, right? And that's part of the discharge planning process. So what happens is you get an appointment scheduled for for the individual, right, who's being released. And that's part of the post-release process, where the jails are now even starting to call to see if they made it. They do the Medicaid applications, different things that a person needs upon access back into the community. And the medication appointments and linkages is a very important piece that is done. Linkages to the opioid treatment programs for methadone, linkages to doctor's appointments for buprenorphine prescriptions, and so forth. So that is happening, and that's part of the discharge planning. The whole part of the discharge planning goal. And that's why that was put into the law, to make sure not only are you keeping them safe and well in the carceral system, but you want to have them return to the community safe, so that they do not attempt to use illegal drugs and overdose.
Thank you, Rabiah. And I think we'll come back to this response again, the reduction in overdose when someone has received treatment, but also just engaging in care for those who received methadone while engaged in incarcerated. They are almost 70% likely to link to care post-release, as compared to only around 8% who just received counseling, for example. So there's one other question just to put out there while we're thinking. One problem I see linking treatment to the criminal legal system is that it links this individualistic framework of success or failure to carceral punishment. How can we concretely move beyond this framework? I'd like us to think about that question as we move into the panel, because that's, really, we need practical examples, and it's really important to people's lives. So I want to introduce our panel, and distinguished panel, and thank you so much for your time today. We have with us, Sheriff James Quattrone from Chautauqua County, New York, who's been very central to our collaboration in HEAL. It's been really amazing the way he's implemented a medication for opioid use disorder prior to actually being required to by state law. And he's combined many sources of funding for that. I'm going to introduce the Honorable Charles Tailleur, who is in the middle of a major trial, but he made time for us today. I've listened to him talk empathically and really committed to those people participating in his treatment court there in Greene County. We have Ryan Caldwell, who has been a part of the HEAL initiative on our state community advisory board from the beginning. He is a discharge planner and actually has training as a certified recovery coach as well as that training. We also have Chief Stephen DeGatta from Sullivan County, the chief of police there in Liberty. He's been very central to the Hope Not Handcuffs approach there, received special funding there, and also their program responding to post-release using, post non-fatal overdose using peers. And then of course our Julianah, Chad, and Rabiah will remain with us. So I'm going to just pose a question, just a general question first. And I would just like to put it out there. Please provide like one example of an effective community partnership to reduce overdose in your community. When you think about that, what comes to mind? Who wants to? We've just heard a couple, so I want to hear from maybe someone new today. A community-based successful program to reduce overdose.
I can jump in on that, Timothy.
Sure.
Sure. So the Liberty Police Department's collaboration with Hope Not Handcuffs is a not-for-profit organization. The collaboration between the law enforcement aspect of the police department, the not-for-profit Hope Not Handcuffs, and then really through that organization, their angels, which are community-based volunteers who often either have been personally affected by the opioid epidemic or have someone in their family that has had been directly touched by it. Bringing those three aspects together, where you have the law enforcement that is out there on the streets every day dealing with the issues, and then bringing in the community and that collaboration of working together. And specifically in Sullivan County and in Liberty, we've used a PARI-based model system of officer referral, self-referral, so they can walk into the police department, and then also, as you mentioned briefly, a post-overdose response. But doing everything hand in hand with the volunteer community members as well as certified peers has been really, really important for our agency, and we've seen some real positive results from that.
Thank you, Chief. Anybody else want to share an example?
Hi, Tim, and hi, everybody. I would agree. The first thing that came to mind with that question for me was Hope Not Handcuffs. It's such a wonderful program. And it also made me think of like just the community coalitions. I know my local community coalition, although it might be a prevention coalition, some of the work that they've done, installing the naloxone cabinets throughout our community, hosting Narcan trainings, doing all this outreach and awareness work. I don't have like the actual, statistics on how much it reduced, but I know, that community-based work, working with the police department and, religious leaders and, business owners and really coming together, and our school districts too, where I live, have been major at letting us come in and educate the kids, and hear from them. So those to me, I just really think that it's super successful when you see everybody like that working together.
Thanks, Ryan.
It's definitely important that we have that collaboration. Chautauqua County, we have a monthly meeting about behavioral health and law enforcement, and we have not only law enforcement, all law enforcement agencies are invited. Unfortunately, not all always show up, but then we have as many providers, both governmental providers as well as private and nonprofit. And I think that collaboration where we can share information, get to know each other before there's a crisis, before there's something going on, and we're able to work better together.
Thank you. I think I want to ask, I'm going to shift it a little bit. I want to ask, what are the ingredients would you say are for successful completion like mandated requirements, which is again kind of goes away from the question I shared earlier, but there are some mandates, for example, in treatment courts or for probation, for example. Like, what are the ingredients of success there, and how do you take in the individual needs and goals and purpose of that person who happens to be subject to those mandates? Maybe I could ask the Judge Tailleur.
Yeah, Tim, thanks for inviting me. I couldn't agree more in terms of everything that everybody said. It seems to me we're all on the same exact page of the earlier intervention we get with folks that are suffering, period, the more success we can have. And so in terms of my own intervention, that's my community partnership, is to encourage law enforcement or anybody involved in the process. If the person is appropriate for court, the sooner we get them into court, the sooner we can treat them with the compassion and empathy and accountability as well. And the reality of all these problem-solving courts statistically is once you get people in that setting, a real high percentage of them succeed. And they succeed at a higher rate because of the approach that we all have of combining all the, the expertise and the thoughtfulness. And that's been my experience generally.
I think for us, it's the, I think for us, it's the collaborative effort between our team and the rest of the legal system. To be able to work with a judge face to face for an individual's treatment is incredible. We're very fortunate in Ulster County where we do have that. We have the full support of our district attorney's office if we are working with an individual, to ultimately give the DA's office an update so they know that the individual is doing what they need to do to meet their requirements. The making those connections and the collaborative effort amongst the different partners in the criminal justice system are key to a successful team like the Oracle team.
Yeah, that's it.
What happens, and I wonder, maybe also Ryan, if you can weigh in, what happens if the goals of the mandate are not necessarily fit with the kind of the person-centered approach, their own personal goals, for example, or even sometimes we're seeing certain mandates that don't quite fit with even the treatment recommendations that can come. It can be very confusing sometimes who to listen to, right, or which directive to take. Have you seen that, and how do you address that?
Yeah, it definitely can get confusing. I think I also should let everybody know that I've been in long-term recovery for over 10 years. I'm also formerly incarcerated. So I've lived this, and I think that what's valued most for me, being a part of this team for the past few years is my personal experience, and I feel like speaking for myself and a lot of my friends, being someone in recovery or new on that journey in recovery, you want to feel like you have a purpose. You want to feel included. You want to feel like you belong somewhere. So I think when someone's in treatment court, or and this can count across the board, for reentry and everything, connecting with that peer support is so important. So important, because I can go to my clinician and have that 1 hour individual session, but when my buddy who's been in recovery for X amount of years takes me out to the diner just to sit with me and just to have a cup of coffee and just to talk to me and just to make me feel like he actually cares what I'm saying, that's what keeps me coming back, and that's what makes me feel, because this is, we're talking about human beings here, feel something that I haven't felt in a long time. Like, hey, I do matter. I do have a purpose. He wanted to hear what I said, and what he has, I want, or what they have, I want. So I think, and I'm sure a lot of treatment courts have peers, and I know people are connected to peers. I know, personally, when I was working as a peer, and this is just me, I was limited to certain things that I could do. I wasn't able to go out and pick somebody up and take them out to eat, and maybe it was just the setting that I was working in. But I remember, for a couple of years feeling like I wish I could just go and do more, but I was restricted to certain things that I could do. Now that was a couple of years ago. Things may have changed, but that one-on-one human connection is just so important, for someone in recovery. Even now, 10 years later, it's just so important. I still go to the diner every Wednesday night. I'm there. You can find me, and for me, that's just where I've seen the most success, man, is making somebody feel like they're important and they matter and that they belong and that they can do it, and just having that human connection.
And that's the role of the court. I mean, the court, I feel duty bound to create an atmosphere where people feel valued, feel listened to, period. And in terms of over time, we see them go from having very short-term goals to medium and then long-term. And we get this wonderful experience of seeing so many of them reach those goals.
Mm-hmm.
To your point, Tim, I think there are occasions where I think you were talking about treatment decisions within the court, or and really the model I try to follow is there's an element of meeting the person where they're at. Goal number one is to get them in the door, because you get them in the door and you start treating them just as Ryan said. You treat them like that, then they want to come back. They want to come back, because they're feeling the sense of the system treating them differently maybe than it has in the past, or whatever. And then there's often difficult decisions with regard to early treatment where there's some discussion that, for example, how long somebody in a treatment court when they're an outpatient, but they're tested, you're getting some positive screens for fentanyl, you're getting positive screens for something that obviously could be deadly, and that delicate balance there, and it's debated much in terms of how you progress the treatment, how and when to use incarceration in a treatment court. Difficult choices for judges, because the severity of an overdose, that those are, but ultimately over time they often understand they need a higher level of care and they go to it willingly. I guess that's what I would say about that.
I want to just add to what has been said, that for Oracle, for instance, bringing in civilians into that programs really bridge a lot of gap in terms of changing paradigm shift, how community members look at law enforcement. That has brought a lot of individuals in the community feeling comfortable to come to get help, to call. The safety and building trust has also helped. More importantly, the collaboration, just like Chad has said, going to the courtroom with an Oracle staff. We have peer partners, that's really normalized and can relate to what the person is struggling with. That has really helped a lot in bridging those gaps. We get calls from unbelievable places, and we have the advocate, the manager at the jail, who's able to, we believe in alternative to incarceration. Why would somebody be in jail when somebody needs to get help? So the movement, we moving those individuals to get help, to be better, productive member in the community, has really been very successful in this model.
Thank you. I think you really started to hit on another question, which is very similar. Maybe you can just go a little further. I'm wondering how you have addressed the historical and even sometimes current negative perceptions of the criminal legal system, right, in that community. How do you ensure them that there is reasons to trust? And again, I've talked, Chief Tagata, for example, your program shows up to someone's home after there's an overdose. It's like you show up in a uniform, and this is a scary moment, right? Why should I talk to you, or why should I call 911 if I know I'm going to get the criminal legal system engaged in my life? And it was over a medical condition, for example, I overdosed. Well, how do you address the trust issues or even negative perceptions that are out there?
Sure. So there's a few things that we do, and we learn these through trial and error. When I first started doing some post-overdose response, it was just me, and I went, like you said, in uniform, And the response was not as great as we've come to find now. So one thing that we do is we have our officers, they dress down, they don't wear their uniforms, they wear like a khaki pants and a polo that bears the Hope Not Handcuffed Quick Response Team logo. We go in an unmarked police vehicle to be as inconspicuous as possible. Also, the addition of the peer to the team and the fact that it's a team effort and it's not solely law enforcement knocking on the door, that really lends a lot of credibility to the officers being there to help them. So those things are important, but in my view, those are kind of really just window dressings to the real meat of how to get that trust. And for me, it's sincerity and it's persistence. So it's really just putting our hearts and our minds and our money where our mouth is, and showing up sometimes, to the same individual time and time again. And after we found after a while of persistently putting our hand out, offering to help, that we see these people warm up to us, even who may be dealing with not just on a general sense, an animosity towards law enforcement, but I'm a police chief in a very small village. So there may be a specific, I may have personally arrested someone in that person's family or them years ago as a detective. So it may be a very personal, individual viewpoint that they're looking through. So overcoming that has certainly been a hurdle, but I think sincerity and persistence would be my two answers to overcome that hurdle.
I would echo what the chief is saying. I might use different terminology. I stress the unconditional respect, but that persistence and consistency. I think for us, one of the big things is not only, from law enforcement, but our peers, our care coordinators, reentry. One of the things when we were trying to organize a reentry hub is what we call it. So when they leave the jail, they can connect right when they get out. Shortly after a community meeting that we had a lot of pushback from the community in doing this. The day later, I walked through the jail, and one of the individuals that is incarcerated there introduced me to some of the other incarcerated individuals. Said, "Hey, this is the guy that's trying to help us." So I think once we can connect with those who need the services and who we're working with, they are sometimes our best advocates. Those are our best people to get the word out there and work with them.
Thanks, Sheriff. And I wondered, maybe this is a kind of a follow-up as well. And for all of you, what has been the impact of the 2021 legislation requiring medications in jails? How has that been achieved or successful? And then what are we seeing? One of the questions is, how is that impacting post-overdose risk after someone is released from incarceration?
I'll jump in first on this. For me, I'm going to kind of answer the second question. What really spurred me to really want to get involved in MOUDD? We had a gentleman who was released from the jail. I saw him out in the park next to our jail and talked to him. He had been somebody I investigated when he was a victim, probably 20 years before that. Was in our jail for about 9 months. Talked about how much help he got in the jail, but then a couple weeks later, they found him on a park bench, deceased from an overdose. And the reality there is we need to do something further than what we were doing. And so we started working. We now are big on using Sublocade, and right now we're being able to utilize that. I'm worried about next year's budget, to be honest with you. That's going to be one of the problems. We're trying to figure out how we're going to continue to use the Sublocade rather than going back to the oral. Yeah, but what we're seeing is, with roughly since the first of the year, we've had 150 unique individuals that have been on the MOUDD. Any given day, we have 35 to 45 people on MOUDD, but into the follow-up has been the problem. And while we have a plan when they're being released, we find probably 90% of those don't follow through with the plan. And so that's where we're trying to have more of a follow-up, bringing in peers that can follow up post-release, and but then connect them as soon as they get out of the jail with the community resources. And that's our hub, our program manager there is working hard to connect and engage, not only with the peers, but with the providers out in the community.
And Tim, and part of the overall concern is when a person's released, them having a place to go live and lay their head down. And when you don't have a place to lay your head down, and it hurts me because I see this in New York City a lot, it's hard to focus on recovery. It's hard to focus on getting to an appointment for medication because you're looking to see where you can sleep, where you can bathe, where you can eat, right? The basic needs. And I think the more that housing is developed and the more that housing opportunities open up for people or transition to some kind of housing upon release, that'll help people stabilize to be able to address their substance use disorder needs, mental health needs, and so forth. So I think, and I know more is being done, but as it continues to be done to help people get a stable place to rest their head, I think everything else will start to get better as well.
Thank you. You know, we do have a housing crisis throughout the state, actually nationally. At the same time, you just heard the sheriff say, how are we going to pay for the medications? Maybe you could speak to that. Is there also a state plan and also Medicaid waiver potential?
Yeah, so the criminal justice Medicaid waiver, also known as 1115, should come into effect, I believe, 2026. So that's a little ways. But for medication now in real time, you have a few sources. So you have Matters. They used to be known as New York Matters, but then now they dropped the NY Matters. That's a place where someone can go and get their buprenorphine, a prescription, get the medication same day, and hold them for a month or two as they apply for Medicaid, wait for it to be opened. Many of the jails are applying for the Medicaid sooner rather than later, so that upon release, that Medicaid would be active. There are there's low threshold buprenorphine locations throughout New York State. If you look on the OASAS website, it'll let you know how to get access to that. That's another avenue and stream where you can get access to medication. So there are, programs out there that'll assist with that.
I wanted to respond to the question there's a question in the chart about whether fatal overdose reduced in Ulster County. It did reduce above 50%. In fact, those data came in today at the OASAS meeting where
Again, the approach, it is not one size fits all. It means we need to address prevention. Again, and I love the question around not attaching goals to the carceral system whenever possible. Again, we know it can be traumatic. It can affect people's lives, having a label. And so we want to be cautious and careful with that. At the same time, again, I hear respect, empathy, treating people with that respect and listening to what their goals are and fitting our plans and treatment plans with those. So the innovation, the collaboration with the communities is really critical. I would like to say that we are going to be engaging 12 new jails in New York State in a new study called Tech Empower, just funded by NIDA. We're going to be looking at integrating substance use disorder with overdose prevention and HIV linkage to care as well. So the approach continues with our partnership in New York State. Thank you so much, panelists and presenters, for today, for this rich discussion and for the questions of our attendees. Thank you for attending and for your partnership in the community. There are some additional resources we want to point to for the Healing Community Study. You may go to our Columbia website here, the healinghcs.columbia.edu. There you will see resources that have been developed throughout the intervention and study, as well as papers that are being published on the outcomes around our community engagement. Additionally, you may go to hcs.rti.org, where you will see also additional resources, as well as the SAMHSA website, where we have a practice guide on how to engage coalitions and communities. We have a practice guide on the opioid overdose risk reduction continuum of care response. And on the next slide, you'll see we have additional correctional health resources, such as, again, as we talked about today, the treatment courts and the 12 elements of those successful courts, as well as you see the SIG website at Columbia University. You'll see We always have an ongoing blog around information and work we're doing in the community, and we welcome your feedback. Thanks again for attending, and I do want to make sure that you do complete the evaluation. We'll be sending out the slides as well as the resources. And if you have additional questions, please contact us. You can contact me by email, or you can also see our website for the Chosen Center or for SIG. Thank you and have a great evening.